Hi, it's Dr. McCarthy here with Thyroid Treatment Success Secret number 12. Today we're going to talk about one of my favorite topics is brain function. There's an area in your brain called the hypothalamus, and the hypothalamus will stimulate your pituitary gland. The pituitary gland is the one that puts out TSH. And if you're dealing with thyroid problems, you've probably heard of TSH. The pituitary puts out TSH to stimulate the thyroid. TSH stands for thyroid stimulating hormone. Very often when you go to the traditional healthcare provider to get your thyroid evaluated, what they're looking at is your TSH. That's really a hormone that comes from your pituitary gland. It can give you some indirect information as to how your thyroid gland is functioning, but it doesn't tell you specifically what's going on with your thyroid. So if you've only had your TSH checked, that's unacceptable. You've got to get the rest of your panel checked, and we can show you how to do that. Remember, we talked about this in a couple of videos now, that your brain needs two things for proper function. It needs fuel and it needs activation. The activation comes in what we do here in our office: neurological therapies, exercise, a different stimulation that we give you and in order to activate proper areas of your brain. Secondly is fuel. The fuel comes in the form of glucose and the oxygen. The oxygen that we use enhanced air therapy. It's called exercise with oxygen therapy. As we age, our bodies become less efficient at utilizing the oxygen that's in the air that we're breathing. We become less efficient at a big fancy word called oxidative phosphorylation. All that really means is you're losing about 1% of your ability to take the oxygen out of the air and to convert it into energy inside your body. That's why we utilize exercise with oxygen therapy. Another thing that's very often overlooked is a neurotransmitter that's called serotonin. Many of you may have heard of the serotonin, but what's important about this is serotonin acts on a specific area in your brain, your hypothalamus, very specifically your paraventricular nucleus. And if you've got this issue, it can lead to decreased thyroid stimulating hormone. Acts on the hypothalamus, leads to decreased TSH, so it can actually cause a thyroid problem. What the issue is you go to the doctor with the thyroid problem and you're just given thyroid hormones. That doesn't fix this issue. You've got to get this evaluated properly. And the number one regulator of serotonin is your blood sugar. In a previous video, we talked about how if you're on this blood sugar roller coaster, it's really hard to get you well. If you're on the blood sugar roller coaster, it's creating serotonin issues, which can create issues with your hypothalamus, your paraventricular nucleus specifically, and it can be a mimicker of a thyroid problem. If you don't know, you're just guessing. We're talking about your brain. Don't guess. You need to know. You need to call us now. Don't suffer another minute. Thanks.